I think that's what we want from our healthcare providers. But I mean, you worked at a healthcare provider. I worked at a healthcare provider. It's yeah, it's not just the technology. We could probably stand up the technology to do it, right? It's I mean because you can do it with a phone and texting back and forth, and it's really rethinking the workflow that has been in place for decades, and that's the hard part. It's redesigning it in a way that is consumer centric. How do you get that level of design thinking, that level of consumer centric thinking in your innovation? Is it just hiring the right people to think that way? Is it hiring onto an organization that already has that culture? I mean, because at PDS you have that. You have a team, you have a leadership team that thinks innovate, innovate, innovate. And you hired Mustafa, so you were able to build the team that you wanted to build. But imagine I just hired you back to where you were before, and we have to do this. We have to sort of change the experience. We have to rally a whole bunch of doctors to really change the culture. I mean, how do you approach that? How would you think about approaching that?
You got you've got to find the leaders with the right mindset, because you're going to find folks, as we did, regularly. I think the EDs were some of our toughest customers, but it was important to forge the relationship with the leadership in the ED, and then the right docs with the right mindset, and let them know, that they don't think you understand the pressure that they're under, right? And I think a lot of times you don't, until we pull an all-nighter and sit in the ED all night watching them and watching, horrific things happen and amazing things happen where they're literally saving lives. That's, I don't miss that pressure, and all I've got to say. But that's the only way you can kind of shift the mindset in saying, just because it's always been done this way, is this right? And it's getting those right folks behind you, and then having them be part of potential new designs that you can quickly iterate on and fail fast on, right? So like you said, it's not just the technology, it's the workflows. So while you're running across that room to pick up a prescription on a printer that's 100 feet away, it makes sense. So why would you not move simple stuff like that all the way? You've got to start from the fundamentals, right? There's a lot of good teachings, I guess, in the the agile workflows and stuff in those clinical settings. But ultimately, it comes down to finding the people with the right mindset. Because if you have people that are going to tell you it's going to fail and never works the way it's been done this way, then nothing's going to change. So you got to change the folks driving the bus.